Hey everybody, welcome to Fearless Friday. My name is Joy Brewster and I'm the Director of Operations and User Engagement at Survive It. Today we have Sandra Manley Eichler, who's an oncology social worker at Northwestern Memorial Hospital in Chicago. And we wanted to bring Sandra on today because most people don't know that they have access to a social worker. They don't know what a social worker does in a cancer setting. So we wanted to bring her on to just give you an idea of the resources that they have access to and how they can make your life easier. So without further ado, I'd like to welcome Sandra. First and foremost, why do social workers exist in a cancer setting?
So social workers are available to cancer survivors in a number of different ways. So I think that probably the way that I like to think about it the most is removing barriers to care. So let's figure out logistically what's making it difficult for you to get to treatment. You'll also encounter social workers who do more of the clinical counseling as well as social workers on the inpatient side of the hospital who are primarily involved with discharge planning. And so I think that this can differ a little bit from, say, like a patient navigator role that you may have or a case manager.
And so how does a patient get in touch with you? Do you typically pop into appointments or do they need to ask their medical team to put them in touch with you?
Yeah, I think it differs depending on what organization you're at. Some hospitals will have a general social work department hotline where maybe there's a administrative assistant who's taking referrals for that social work department, or you can just self-refer directly. For example, I know that my contact information is made public to patients when they're first diagnosed, so they're welcome to call me if they want to. And then physicians and nurses get to know patients over time and they develop a trust. And so for some patients, it can be really great that they identify to their physician or nurse that they're struggling with something emotionally or financially. So with that information, they say, let me see if I can get our social worker in contact with you so that we can address those things head on, whether it's through referrals or maybe something that maybe I can't do directly, but maybe I can refer you to the right person for it.
That's great. And so if the nurse or the doctor refers them, it's not necessarily because they don't want to help them.
Absolutely.
They aren't educated in how to best do that.
Yeah, and I think that that's kind of how healthcare works, right? You know, nobody would certainly come to me to figure out what's the best treatment for metastatic lung cancer. But if they wanted to know resources for getting transportation support, yeah, I'd be your girl. That's what I do. It's my job, and I'm happy to do it. It's something that I enjoy. It's work that I think is really privileged work. But it's absolutely true, and I think a lot of people can see that as sort of being passed off. And I think that with the work that I do with a lot of physicians, they are sensitive. They want to know what's going on with their patients.
Does it cost anything to work with a social worker?
Nope, not a dime. So I think we're really in a good spot as social workers to be able to provide support for patients in that regard. That I'll meet with people and I'll say, guess what? You don't even have to worry about your insurance coverage because I'm covered. I'm here to make sure that we're reducing your burden here at the hospital. The one caveat I would say to that is if you're in a facility where you have a licensed clinical social worker who's providing psychotherapy and counseling, so meeting with people weekly, if the facility is billing, then you may be subject to a copay similar to what you would have for meeting with a psychologist because you're getting that regular ongoing counseling support. But generally for oncology social workers, it doesn't cost anything.
Okay, good to know. Mm-hmm. So let's go ahead and talk about finances. How can you help families with finances specifically?
Totally. Well, it's such a great question because I think it comes up a lot. We read a lot of headlines about how expensive cancer drugs are. I think that the nature of cancer treatment is so disruptive for so many people, whether we're talking about school or work or childcare or any of the many factors of life that become affected by cancer. So when people come to me and they express a particular financial need, I usually try to go head first with whatever they bring to me first, whether it's their drugs, their medical bills, anything that's related to their treatment that they themselves have identified, transportation, any of these other factors. But then at the same time, what I like to say is there isn't a cancer bucket and a life bucket. This is all in one. So maybe if you come to me and you say, I'm really struggling with the copay for a couple of my medications, I may come back and say, well, maybe I can't find assistance for those medications, but maybe I can help you with groceries, or maybe I can help you with transportation. That money is still money that's cash in hand for you, and that's going to contribute to everything else. So we try to get creative. We try to figure out what's the best way to go about it.
It's really wonderful that you offer that. If for some reason a patient is at a cancer treatment center and they don't have access to a social worker, but they still need to find that financial assistance, is there anywhere that you could direct people online, or
Sure.
resources that come to mind?
There are so many places online that provide financial support. I think it's really important to look for diagnosis-specific resources. So even just typing into Google, breast cancer financial assistance, lung cancer financial assistance, and seeing what comes up, because oftentimes what will happen is after a family has been affected by a particular diagnosis, you'll see a lot of people start foundations, specifically maybe in the name of somebody who they're honoring or in memoriam of that person who has been a survivor of that disease, who all provide very different kinds of support financially. So I think a really thorough Google search just on your individual diagnosis. Then for things like prescriptions, I would recommend a couple of different websites. The first of which is needymeds.com, source for navigating copay assistance and pharmaceutical assistance if you do have insurance. So things like copay cards, things like that, it's all in one. There's another couple of websites. One is goodrx.com. Goodrx.com is almost like a price comparison. So if you've ever looked for anything through Google Shopping, for example, maybe you wanted to buy a book, and the book would pop up and show you how much that book is on Amazon and Barnes & Noble and all these other different bookstores maybe, and what's local to you. GoodRx does the same thing, but with prescription medicine. So it might show that you have a CVS, a Walgreens, and maybe Costco or Walmart pharmacy, and how much it costs for each of those. And then another one is RX Outreach. So this is one that you would actually have to make an application for, but it's going to provide you bulk costs for some generic drugs that are discounted. So I think bouncing between a couple of those different resources can be really helpful.
Those are wonderful. Thank you. So what's an example of how you've helped a patient or their care team in the past?
Sure. It's really important to appreciate that if I'm going to be helping a patient, I'm also helping the care team. So being in touch with those people is really critical and important in navigating a particular patient case. So one in particular that I'm thinking of is a patient who has Medicare, and I was asked to consult with the patient on a number of different financial issues as they were related to the health insurance. And so what was really great was between conversations with the medical team and the patient, we were able to navigate what was missing from the insurance. So folks with Medicare will know that you need to have A, B, a supplement, and a Part D plan. So it's kind of putting all of those things together for Medicare. And so working together with the patient and the provider to say, here's what's going on with the insurance, here are the deadlines that the patient is going to need to make, and helping that patient navigate their insurance, and then also navigating the prescriptions on top of it. And then working with the financial counseling department at the hospital. So that's another resource in terms of finances that I would advocate. A lot of people don't know that your local hospital will likely have some kind of financial assistance program, whether it's through their clinical trials department, their general medical oncology department, or the hospital as a whole, or maybe just the social work department has additional financial support for you. And so I think in this case, the patient was able to get full insurance coverage within a matter of a few months. We were lucky enough that the issue came up around open enrollment, so we had a really good time for us to navigate that. But I think it was really nice to be able to work with all the different pieces together. And I think the patient also felt more supported knowing that the doctor said, oh, the social worker is working with you on this, right? Okay, so now we can move on and focus on the treatment piece. A lot of patients are fearful of bringing up financial issues with their provider because they're worried that somehow they're not going to get good enough treatment. That's not the case. Your doctor is going to be able to give you something that maybe works just as effectively, but is cheaper, or they're going to work with people like myself, the social workers or financial counselors, to try to say, hey, this is the treatment that this person really needs. It's the most effective. It's the one that's most researched and evidence-based for that particular patient's case. So let's make sure that we don't make money an issue with it.
So what problems do you see patients running into most and need your help to resolve?
So I think probably the most practical ones are issues of things like transportation. It certainly hits my department in radiation quite a bit because you have to be there every single day. So if you don't have somebody to take you, or if you are just strapped for cash and the finances of that routine transportation keep coming up, then those are the things that I think are just, again, very practical things that come up when people are coming to treatment. Same thing with health insurance. I think a lot of folks don't know, is my health insurance going to cover my cancer treatment? What's going on with my coverage? What's happening with my drug coverage? And sort of answering those questions. Alongside with that, I would also add, a lot of patients come to me after treatment. And I think that we really need to do a better job of screening folks who want support when they're done. When you're done with treatment, you're sort of feeling like maybe you were cut off from a lifeline. Okay, I was having these regular routine visits and now I have to wait. Maybe it's even waiting for scans and you're not actually doing anything in the meantime and you're worried that the cancer is growing. And this could be a time when you're just sitting there with your thoughts and you're thinking, gosh, what did I just go through? And I think that that's really tough for people. And so I really want to make sure that it's at those points, at those appointments, those follow-up appointments when folks are meeting with their physicians for survivorship appointments, that they know that social work is still available to them. And so I think that comes up quite a bit.
That's really wonderful that you offer that. And I don't think many people know about that.
Yeah.
So even after they've completed their line of therapy, they can still reach out to you?
Absolutely. And I think that not only that, but again, we were talking a lot about those resources that are available, right? So it could even be that maybe there's a local cancer support community that provides support groups and things like that for patients for exactly that time. During treatment, you may not feel like you really have the bandwidth to talk about everything that's going on. Plus, you might be working or trying to navigate childcare on top of it, or going to school, or any other myriad of life things that are happening while you're in treatment. So it's when the treatment's done that you have the time to explore it. So it may not even be meeting with the social worker at your hospital, especially because not everybody wants to come back to the hospital. They're like, I'm done, I don't want to go there again. You know, great, then let's at least get you connected with a counselor that's in network with your insurance, or somebody who is available at another cancer support community, that we can do that for you.
Awesome. So do caregivers also have access to you?
Absolutely. I love working with caregivers. I think that what's nice is being in our cancer center. Like I said, I sometimes work with couples, I sometimes work with families. We know the research, we know the data that says that caregiver support is absolutely essential. And by caregivers, who do I mean, right? I mean significant others, as well as siblings, parents, children. It's a whole constellation of caregivers. I've met with best friends, because for those particular patients, really close friends were the ones who were being most affected by the treatment. Maybe family was doing okay, they were coping in their own way, they had their own system, but their friend was struggling. And it could be meeting alone and doing individual counseling with that caregiver, or doing it in tandem. But I think a lot of times caregivers feel some guilt. They don't really want to focus too much on themselves, when we know that it really helps the patients in terms of their stress level. When they see that their caregiver is being taken care of, it's like magic. And there are so many times when people come into my office much later than they could have, and they think, gosh, why didn't I talk to you before? Or why didn't I reach out to this one resource before? Because it isn't just counseling, it's other types of caregiver support, and just letting them have some time. Maybe it's even hiring private duty care and having somebody come at home and cook some meals for them, or things like that. Really leaning on friends and family to sort of remove those day-to-day activities that just take up time and energy that they don't have all the time. So definitely.
We'll have to have you back on to talk about the caregiver perspective. If you had to pick your top 5 favorite resources, what would those be?
Sure. So I'll have to add up quite a bit. So the American Cancer Society has a volunteer driver program called the Road to Recovery, which has been growing even more and more over the last couple of years, as well as a program that provides actual tickets for patients so that they can ride public transportation if they can. I think that, in addition to other support systems that they provide in the community, like for example, they have something called the Look Good, Feel Better program. And so this is sort of a healing from the outside in kind of a program, and I really like it. It's matching up cosmetics to help navigate sort of disguising the symptoms of chemotherapy. So eyebrow and eyelash loss, sort of that dullness that can sometimes come over from chemotherapy. So providing these really nice cosmetics products for free. Another one I want to mention is Cancer and Careers. So Cancer and Careers is also based out of New York, and I just think they have such a wealth of information. So like the name implies, it provides a lot of educational material for folks when they're trying to navigate everything going on with their cancer diagnosis and employment, which could be a general job search and maybe returning back to work after treatment. Maybe if you're just starting to leave work and you want to know what's available to you in terms of benefits. And I also like that they have webinars that are available for patients for things like body image, for navigating your social media presence, which I think is really fascinating and something we don't talk about too much. How much do I want to disclose of my cancer on my Facebook page, LinkedIn, things like that, right? So important. As well as health insurance information, so it's super helpful. And let's see, Triage Cancer is another one that I really like. Same thing, doing a lot of navigation for health insurance, but also talking about a lot of more psychosocial issues that happen with patients. So what's going on mentally, how are people feeling supported or not supported, whether it's in their community or not. Let me sort of finish off by saying this then. So I think that the resources that, patients are their own resource. You are going to know what piece of yourself needs to be helped the most in that moment. And sometimes we're afraid to ask for it, but I think that by really just sitting back and getting in touch with yourself and figuring out, is what I'm experiencing truly an issue of a deficit in my finances? Because it could be. It provides a lot of stress. In fact, that's a big reason why I went into social work in the first place, is saying I love psychology and I love the way that we talk about counseling and how the mind works. But sometimes at the end of the day, the biggest stressor you have is how am I going to put food on the table? And I think that that's something that we have to acknowledge. For a lot of other people, it might be spirituality and sort of having a crisis of faith, and maybe that's the biggest obstacle. So in a way, you are your own resource. You are the one that's going to be able to pinpoint and navigate what it is that's going to be most challenging. And if it's not as easy to come up with it just like that, then talking it over with somebody, I think, can really help.
Well, Sandra, thank you so much for your time, and more importantly, everything that you do for those facing cancer. We will get the links to the resources that Sandra mentioned up for you to access, and you can also take a look at the resource library on surviveit.org. Until next time, stay strong and live fearless.